Today we are going to do the assessment of the peripheral vascular system. The purpose is to evaluate the student's performance on the use of correct techniques in performing a thorough physical assessment and to differentiate normal from abnormal findings of the peripheral vascular system. So the materials we're going to need are gloves, centimeter tape or tape measure, stethoscope, a Doppler ultrasound probe, a conductivity gel, tourniquet, gauze or tissue, and a blood pressure cuff. First is perform hand washing. In the absence of a hand washing area, you can just alcoholize. Gather the equipments needed, provided I have already gathered the equipments. I am now going to explain the procedure to the client. Good morning, ma'am. I am Phoebe, your nurse for today. What is your name, ma'am?
Marie.
Okay, ma'am, I am going to assess for your peripheral vascular system, wherein I will have to check for your arms and your legs. Is that okay with you, ma'am?
Yes.
Okay, if you feel any discomfort, ma'am, please tell me. First, inspect bilaterally for size, presence of edema, and venous pattern. Ma'am, pakikasti lang dati imam, ma'am. And then inspect bilaterally for skin color. Observe for pallor, redness, and cyanosis. And then inspect fingertips for color. Palpate fingers, hands, and arms for temperature using dorsal surface of your fingers. Next, palpate to assess capillary refill time. Normal should be less than 2 seconds. An increased capillary refill indicates vasoconstriction, shock, or hypothermia. Palpate radial and ulnar pulse and brachial pulses. Palpate epitrochlear lymph nodes behind the elbow in the groove between the biceps and triceps muscles. Ma'am, please make a fist. Okay, so we are going to perform the Allen's test by occluding the radial and ulnar arteries and observing the pallor. Please open your hands, ma'am. To assess ulnar patency, release the ulnar artery and watch for color to return to hand. To assess for radial patency, repeat the procedure as before. Put at the step and then release pressure on the radial artery. Ma'am, please open your hands. Do the same on the other hand. Inspect bilaterally for skin color. Client should be in supine position. Inspect bilateral for distribution of hair. Inspect for lesions or ulcers. Note whether margins are smooth and even, such as pressure points, size, depth, drainage, and color. Inspect for edema, unilateral or bilateral. If cuffs are asymmetric, measure cuff symmetry. If client has edema, determine whether it is pitting or non-pitting. If client has pitting edema, rate on a 1+ to 4+ scale. For the rating, 0+ for non-pitting edema, 1+ for mild pitting edema, which is 2 mm, 2+ for moderate pitting edema, which is 4 mm, 3+ for moderately severe pitting edema, which is 6 mm, which lasts more than 1 minute, and 4+ for severe pitting edema, which is 8 mm that lasts more than 2 minutes. Palpate bilaterally for temperature of the feet and the legs. It could be cool, warm, or hot. Use dorsal surface of hands to palpate. Palpate the superficial inguinal lymph nodes while keeping the genitals straight. If detected, note size, mobility, or tenderness. Next, palpate and auscultate femoral pulses over artery and listen for bruit. Palpate popliteal, dorsalis pedis, and tibial pulses. Inspect for varicosities and thrombophlebitis by asking the client to stand. Ma'am, please stand. Perform position change test for arterial insufficiency while client is in supine position by placing hand under both of the client's ankles. Raise legs 12 inches above the heart level and ask the client to pump the feet up and down for 1 minute. Ma'am, please put up your feet and put it down. Have the client sit up and dangle legs. Ma'am, please sit down and dangle your legs. Note color of feet. Time the interval for color to return. If varicosities are present, perform the manual compression test by having the client stand. Ma'am, please stand. And then firmly compress the lower portion of the varicose vein with one hand. Place the other hand 6 to 8 inches above the hand. Then feel for pulsation in the upper hand. If varicosities are present, perform the Trendline test with client in supine position. Elevate the leg 90 degrees for 15 seconds. With the leg elevated, apply a tourniquet to the upper thigh. Assist client to a standing position and observe for venous filling. Ma'am, please stand up. Remove the tourniquet after 30 seconds. And watch for sudden filling of the varicose veins from above. Perform hand hygiene and then validate and document your findings.